I recognize the member for Prince George Valemount to move the motion.
Thank you, Mr. Speaker. And today I do move the following motion. Be it resolved that this House agrees that the government must do more to address the crisis in women's health care. I'm very glad to have the opportunity this morning to rise and make some comments about the issue that impacts millions of British Columbians, an issue that is essential that we discuss and yet is very often overlooked. We know that the healthcare system in our province is failing women. There is gender inequality in healthcare, Mr. Speaker, and there are wide gaps in research and treatment. And those gaps, Mr. Speaker, can mean major health issues. While our entire healthcare system is failing British Columbians, it is also true that women are more likely to struggle to receive the care they need when they need it. And there are countless examples across the province of how our system is failing women and gender-diverse people. Right now, for example, Mr. Speaker, BC Women's Hospital, the average wait time for the chronic pain and endometriosis program is currently 9 to 12 months. Additionally, a doctor's referral is required to enter the program, complicating matters for those who simply do not have access to a family doctor. Anyone knows that someone who has lived with endometriosis knows how long it takes to get a diagnosis, and that 12 months feels like an eternity when dealing with debilitating chronic pain. On top of that, Mr. Speaker, BC has the second worst discrepancy in pay between doctors who perform reproductive and urologic procedures on female patients at 61%. This is more than double the average pay gap. We have regularly heard horrific stories that women have faced in our medical system. We've heard the story of Sonia, who lost 3 liters of blood in the hallway of Langley Memorial Hospital while waiting for treatment following a miscarriage, or Allison, who was told to consider medically assisted death because she couldn't get access to cancer treatment, and of Jane, who had a heart attack months after being told that her cardiac symptoms were probably just anxiety-related. I want to focus for a moment on heart-related issues. Heart disease is the leading cause of death among Canadian women, killing 7 times as many women as breast cancer. In 2019, 20% more women in Canada died of heart failure than men, and 32% more women died of stroke. And yet, Mr. Speaker, 2/3 of participants in clinical trials on heart disease and stroke have been men. Misdiagnosis is a huge problem when it comes to heart-related issues with women, as they are much more likely to have symptoms dismissed or go unrecognized because they are so different than what presents in men. To quote Heart and Stroke, "For women's health to improve, the healthcare system needs to catch up to the fact that women's hearts are different and ensure that new knowledge about women and heart disease is translated into better prevention, diagnosis, and treatment." After all, Mr. Speaker, if we fail to study women, how can we possibly find optimal ways to treat or care for them? Did you know that the most common symptoms of a heart attack in women include discomfort in the neck, jaw, shoulder, upper back, or upper belly, shortness of breath, nausea, and vomiting? It's not what we've been taught to identify as the typical appearance of a heart attack, and it's why half of all women who experience heart attacks still have their symptoms go unrecognized, and they are less likely than men to receive treatments and medications in a timely way. That is why it is so incredibly important to have women represented in studies and in clinical trials, and why funding for research and education on women's heart health specifically is so critical. Mr. Speaker, we have to improve access to family doctors, to specialists, to imaging, and to treatment. We must invest in education and research that will ensure that women in British Columbia do not fall through the cracks. And Mr. Speaker, that is going to take exceptional leadership. And currently, this province is being failed by a government that is unwilling to take the lead. Women deserve high-quality health care, and they deserve it when and where they need it. Unfortunately, Mr. Speaker, the consequences are significant when that is not the case, And Mr. Speaker, I think there are very few British Columbians who would argue that they can get the health care when and where they need it today in our province. We can and we absolutely must do better for women in British Columbia.
Thank you, member.